Hi, I'm Dr. Bhumi, and let's continue with our viral rash series. And we will talk about herpes viruses and also hand, foot, and mouth today. Herpes virus is most commonly in children caused by herpes simplex virus 1 or HSV1 and sometimes by 2. HSV1 primary infection usually presents as painful sores inside the mouth, on the tongue, on the gums, and around the lips with associated fever, fatigue, and poor appetite. Now, recurrent episodes are usually mild, and they are usually caused by the virus reactivating after laying latent in the body, and it's usually during times of stress, immunocompromised state, or even exposure to sunlight. Now, the presentation of recurrent episodes are usually mild with isolated cold sores around the lips. Now, primary infection peaks at anywhere from ages 6 months to 6 years old, and it is spread by oral secretions. Its incubation period is anywhere from 2 days to 2 weeks, and basically 90% of the population will be affected by the primary infection by the time they reach adulthood. Now, treatment usually entails making sure the child is hydrated, there is good pain control, and even using some barrier cream around the lips to make sure we're not getting any kind of lip cracks and adhesions. There is use of acyclovir, which is the antiviral medication, and we consider those in higher risk populations or even as suppressive therapy in those who are getting recurrent infections. Complications of HSV include recurrence, superimposed bacterial infections, even lip adhesions, and we also see something called herpetic whitlow, which is the spread of that virus onto the skin, causing isolated areas of blistery rashes, and even encephalitis or esophagitis. Now, HSV 1 or 2 can actually affect newborns from the mom through vaginal delivery. The presentation usually happens in the first 28 days of life, but can present as late as 6 weeks of age. Usually presentation can be isolated vesicular or blistery rash, but could also present as severe as fevers, lethargy, and even sepsis. So any thought of possibly having HSV in a newborn requires immediate hospitalization, immediate septic workup, and treatment. So now let's talk about hand, foot, and mouth disease. That is usually caused by multiple strains of Coxsackie virus and enterovirus. The most common Coxsackie virus is A16, and the most common enterovirus is A71. Now, hand, foot, and mouth is highly contagious. It is spread fecal oral, but also respiratory. And that's why you're going to see such large outbreaks in daycares, preschools, and even camps. Now, incubation period is as short as 2 to 5 days, and the child is contagious for about the first week. Now, presentation can be as mild as just a little rash and a sore throat, but it can also be as bad as high fevers and a pretty severe rash. Now, classic presentation is you'll start to see the child being a little fussy, not wanting to eat as much, and then you'll start to see a rash coming on. It's usually pretty quickly where you'll start to see little red bumps, sometimes starting in the diaper area, but then kind of spreading throughout the body with main concentrations on the hands and feet and around the lip, and those rashes can be a little bit fluid filled. This rash is usually not painful, but there are a few strains that might cause a painful rash. Now, complications do occur in hand, foot, and mouth, but are pretty mild and usually rare. Complications include dehydration. They also could include peeling of the skin of the hands and feet about 2 weeks after the illness, and even peeling of the nails about a month after the illness. Neither one of those two really require any kind of treatment. You could also see superimposed bacterial infection, and on rare cases you could see severe as myocarditis, encephalitis, and meningitis. So the mainstay of treatment for hand, foot, and mouth is again supportive care, where we're ensuring fever control, hydration, and pain control. I thank you guys for listening, and we'll see you next week.